Testing. Okay. Hi guys, we're about to start the ceremony in a couple of minutes, so if you're outside, come inside and let's get this thing going. Okay. We're still waiting on a couple more people, so we'll be starting in about 5 minutes.
Alrighty, can everybody hear me? Wonderful. Good morning, everybody. Welcome to the White Coat Ceremony here at Poznan University of Medical Sciences. My name is Alfred Malomo Jr. I'm a first-year student, and I have the honor, with Jasmine Collins, my colleague, of being your Masters of Ceremonies today. I want to take this time to welcome all the students who are in the audience, who are here, who are second-year students. I want to welcome people who are watching this ceremony live, online, and people around the world. Welcome to those individuals. And then last but not least, I want to take this time to introduce our distinguished authorities here at Poznan University of Medical Sciences. So after I say a name, please give a brief round of applause. So first, Professor Katarzyna Ziemnicka, Director of Center of Medical Education in English. Round of applause, please. Thank you. Associate Professor Agnieszka Malinska, Vice Director of Center for Medical Education in English, Associate Dean for Basic Science of the MD program. Associate Professor Justyna Opido Szymacek, Vice Director of Center for Medical Education in English, Associate Dean for Dentistry program. And then last but not least, Professor Jan Mazela, Associate Dean for International Cooperation. So again, we're honoring today our second-year students who are in our medical program and our dentistry program. So without further ado, I would like to take this time to introduce, again, my colleague, Jasmine Collins, who will deliver our welcome address.
Good morning. I firstly want to congratulate you all for having the braveness, better yet, the audacity to start graduate school in the midst of a pandemic. You have the courage to start a new life in a new country with an unknown language far away from family and friends. Now look at you. You're entering into your second year, which is not the easiest. You finally made it to your white coat ceremony, which is well-deserved. This ceremony represents the beginning of your medical career. It is a special rite of passage, and it is an honor and privilege to take care for people in the capacity that you soon shall have. One of my favorite activists, Nelson Mandela, once said, "Education is the most powerful weapon which you can use to change the world." With everything that's going on in the world right now, COVID, racial injustice, women injustice, LGBTQIA injustice, religious injustice towards Muslims, and climate change, just remember, you have a very special role here to play as students. You all are now in unique positions. You have a platform, and your voices will be heard. So I say, congratulations, powodzenia to what you've yet to accomplish, and powodzenia to the beginning of your career. Now I would like to invite Professor Jan Mazela, the Associate Dean for International Cooperation, to deliver their speech.
Hello, everybody. Good morning. The White Coat Ceremony is a rite of passage for medical students and was created by the Arnold P. Gold Foundation in 1993, so not so long time ago. During the ceremony, a white coat is placed on each student's shoulders, and often the Hippocratic oath is recited, signifying their entrance into the medical profession. It is a symbol of the shift from the preclinical world to clinical one. I wanted to share with you some of the thoughts I have regarding this attribute, the white coat. The first flashback is my own experience with white coat. When I was asked by the director of the Center for Medical Education in English, Professor Katarzyna Ziemnicka, my boss, if I would be willing to have a few words for you, I lightly agreed. But later the thought came to me, I never wear a white coat. And isn't it ironic that I was asked to talk to you about this symbol, the attribute of being a doctor? I have stopped wearing white coat during my fellowship in neonatology in the United States. I have had rotations in general pediatrics in the pediatric clinic of the Georgetown University in Bethesda, run by Dr. Anna Erdmann. I have to mention a few words about Dr. Erdmann, because she was one of my first role models, my tutor, and an exceptional person. She was a granddaughter of the famous Polish writer and journalist Melchior Wańkowicz. And she was the one who stopped me from wearing the white coat. She took me to her office after my first day at her clinic and told me, "Jan, we are not wearing white coats. We just wear casual clothes or scrubs." Well, the scrubs they were wearing, they were not the scrubs, but rather pajamas with teddy bears, balloons, toys on it. So I thought, how I will be distinguished that I am a doctor if I am in pajama or just a casual clothes. So she saw my hesitation undoubtedly present on my face and replied, "Jan, our patients are afraid of white coat. Whenever they see white coat, they start to cry because usually there is some pain related to their visit in the office, either blood sampling or vaccination. So we try to release their hesitation and at least not to wear white coat." Later, during neonatal intensive care unit rotations and follow-up clinic rotations, where I had to shift from one place to another in the same day, I have learned that tie is also not an option to wear. Kids love to catch hanging things over their heads, so my tie was in the hands of many kids. So my tie was cut down to bow tie, so that I would not be spreading any germs between kids. So for those of you who want to do pediatrics, keep that in mind, that you will need to accommodate your clothing to your patients. But coming back to my white coat story, since then I'm wearing my white coat only in my heart to remind me that I am a doctor. A little bit of history, the second flashback. It may surprise you to learn that historically and up through the late 19th century, doctors actually didn't wear white at all. In fact, they only wore black. The black garments of the doctors of the past not only signified their somber, serious presence that, let's face it, it was pretty much associated with death most of the time, but they also served the pretty practical function of disguising dirty garments and all of the messy stains of the profession. Out with that black look of death and in with the clean, sterile look. Hospitals made the switch to equipping their beds with fresh, new white sheets. Nurses topped their heads with white caps. And doctors donned fancy new white coats meant to restore the public's trust in them and their new hand-washing skills. Sure, the black coat may have been a little more practical in terms of hiding stains or ushering a patient to the other side. But the white coat became an overreaching symbol of the new phase of medicine. The shift happened relatively quickly, as two famous paintings by Thomas Eakins famously depict one portraying an operating theater of doctors all dressed in dark coats in 1875, called the Gross Clinic. And you can see this painting in the anatomy department. And the second in 1889, called the Agnew Clinic, with doctors all wearing white coats. No one is 100% sure where the first white coat came into the picture or who exactly designed it, but it is clear that the white coat became synonymous with portraying the doctor as a clean, safe source of authority in the new and improved medical field, and the image has never really left. And thus, the iconic doctor's white coat was born. Is the white coat doing anything good or bad? Well, I told you a minute ago why in pediatrics world we try not to use too much of a white coat, but you probably also have heard about the white coat hypertension. Nevertheless, many patients still find comfort in the symbol of the white coat for medical professionals. So it remains a central figure in patient-centered care. Thankfully, however, today's medical professionals do have choices. In fact, doctors, nurses, nurse practitioners, and physician assistants can have the best of both worlds, with practical, comfortable scrubs that can function in the role of hands-on patient care, and professional lab coats that have a modern fit and quality material. The meaning, the third flashback. I'm looking at you today. You all have smiles behind masks. You seem happy, proud. You are doctors, almost. Today, you're empowered to wear the iconic symbol of medical professional. But I want you to wear this white coat not only in your shoulders. I want you to wear it in your heart. To be not just a doctor, but to be a good doctor. It is known that patients respect the white coat. They look at the white coat with hope. The hope for cure. They were admitted to hospital because they had to, because they didn't feel well, because they felt pain, fatigue, or maybe because they have serious illness already named, like cancer. The hospital or clinic environment is not friendly for them. They feel very insecure, lost, sometimes frustrated. You, the good doctor, is not only the professional like handyman who will give them diagnosis, prescribe solution, fix the tubing, repair the leakage. You are a human being and doctor. Talk to them, hold their hands, joke with them. Then you will see a smile on their face, which may appear regardless of the tough verdict that you have passed on them after biopsy test results came back from the pathology lab. The secret of being a good doctor is to find balance between professionalism and humanism. Let the white coat carried in your heart helps you to find this balance throughout your professional life. Let just not be an attribute. Let it be a reminder. Be a good doctor. I wish you all today. Thank you.
Thank you again, Dr. Mazela, for that wonderful speech. So, next on the agenda, I'm going to introduce our guest, Dr. Amira Shadi, the MD medical graduate from the class of 2021 to deliver a speech. So please welcome her. A round of applause.
Good morning, ladies and gentlemen, distinguished deans, members of the faculty, family and friends watching us today, and most importantly, the students. It's my honor to speak to you today on this special occasion of your white coat ceremony, a tradition that is a symbol of embarking on this great journey. The pandemic took away the opportunity for you to have this ceremony after your first year. So first of all, congratulations on passing your first year. You should be proud of yourselves because you've made it this far, so you fully deserve this celebration of your achievements, and may it be a motivation for the next few years ahead. Medicine is not just a profession, it's a lifestyle. You've made a choice to commit yourself to a lifetime of hard work, dedication, and sacrifices. You will be challenged during your studies, when you graduate, and throughout your whole medical career, by your peers, your professors, and your patients. That's why you need to remember why you started, why you chose this career path. I remember my white coat ceremony on June 2nd, 2016. Funny enough, on June 2nd, 2021, I graduated and became a doctor. I remember getting on the stage and having my white coat put on. I remember the emotions and the thoughts going through my head. It felt like a very special moment. It is indeed a big step in your journey. Wearing a white coat and a title comes with a great responsibility. Never forget about it. Now at work, I have these moments when I think to myself, wow, I made it. And just a few years ago, I was in your place. The time goes by quickly, so believe that you can make it as well. Wherever the life takes you, wear your white coat with pride, but at the same time, with compassion and humility. Stay humble. Being a healthcare provider is a privilege. To be your patient's caregiver, to be the only person standing by their deathbed, the last smile they see, the last conversation they have. But on the other hand, the person they rely on during their long treatment process. Don't you ever forget that for the patients, you're the symbol of care, hope, and trust. Today you're going to take an oath. the same oath I took 5 years ago during my white coat ceremony, and the same oath I took 4 months ago at my graduation, and the same oath healthcare providers all around the world take, and is a symbol of ethics. I hope you do it with awareness and you follow it in your medical career. If you ever doubt yourself, I hope that seeing your patients smile and gratitude will pay off all the hard work that you've had to put in throughout all these years, and that it will make you feel like you picked the right profession. Remember that the knowledge you acquire now, you will use during your whole professional life. So don't study to just pass your exams. Study to understand and become a better healthcare provider for your future patients. Medical studies are not only about spending time with books. It's the time for your personal development. It's the time and community that teaches you leadership, commitment, responsibility, and perseverance. So stay kind to one another. Help each other out. It's a teamwork, now during medical school and later on. The last thing I want to share with you is a piece of text that has been with me since my second year. I've had my Elements of Professionalism course taught by Professor Mazzella, who made it possible for us to have a few lectures with Dr. Truman Merritt from the US. Dr. Merritt gave us some assignments that we needed to send back to him. They were essays on some important topics in medicine like patient autonomy, kindness, and professionalism. Dr. Merritt shared with me the following text that I want to share with you now, and that has been one of the greatest influences throughout my medical school, and I know I will go back to it throughout my life. Let me introduce myself. I am your patient. I am the king's daughter. I am your patient. I live under a bridge. I am your patient. I am governor of the state. I am your patient. I fry hamburgers at McDonald's. I am 83 years old next week. I am 17, going on 35. I am black, I am Chinese, I am Dutch. I am a Muslim, I am a Buddhist, I am Christian. I am a woman, a man, gay, straight, rich, poor. I am fat, I am tall. I am skinny, I am short. I shop at Nordstrom. I shop at the House of Thrift. I drive a Porsche, I ride a bus. I'm powerful, I'm not. I'm funny, I'm dull as bones. I'm rebellious, I'm sensible. I'm sympathetic, I'm negligent. I am dying, I hurt bad. I'm expecting my first child. I'm on drugs. I was shot in the abdomen. I was raped. I need my teeth fixed. I need my life fixed. I need your attention. I need my dignity to survive, in addition to my body. I need to know your name. I need to know you care. I need to understand what you are talking about. I need information. I need to make decisions. I need you to protect my privacy. I need your smile. I need you not to give up on me when things look discouraging. When I see you, I need to know I'm not just a number. When I see you, I need to know I'm not in this alone. When I see you, I need to know I'm getting first-class care. When I see you, I need to know I'm your most important patient. I am a free being. I do have a power of choice. I may come to your hospital. I may go elsewhere. Are you happy to meet me? Do you want me to stay? I am your patient. Let me introduce myself. I want to leave you with this, and I hope it inspires some reflection. So as a member of the medical profession and a recent graduate of PUMS, I want to welcome you to the start of this fulfilling lifelong journey. Congratulations and good luck, future doctors.
All right, the time that you've all been waiting for a couple of years now. So, I would like to invite students to the stage, and we're going to read your names in alphabetical order, Jasmine and I. So we're going to do our best to pronounce your names correctly. Apologies in advance if we do make any errors in that. So again, students, make sure you have your white coats already on, and you're going to have the opportunity and pleasure to make a fist bump with the authorities for the Center of Medical Education in English. After that is done, you're going to return to your seats and take the Hippocratic Oath. So again, I'm going to have Jasmine start by reading the first few names. Go ahead.
Firstly, I'd like to call Mahmoud Abdallah, Bushra Abu Healy, Alcidiak Alexandre, Fatima Alsaman, Zaid Al-Shakarchi, Manzoor Andy, Olivia Biernat, Min Chao, Chejin Qian, Yue Chao,
Ashley Connor Guscott, Diana Cordova, Casper Shaja, George Daniel, Richard Darkash, Kareem El Mokadam, Nader Elio, Shelby Embry, Omar Fayed,
Natalia Yemzeka, Mirna Hamada, Ali Hulk, Tamara Hussein, Musa Itini, Heron Jarua Wongs, Shania Kathy Karamati, Oshini Kahil Wathugoda, Nowakowski Kevin, or Kevin Nowakowski, Khan Kish Mala,
Nathalie Kokon, Alexander Kravitz, Ying Zhu Lin, Michael Majierski, Miral Makdoum, Alexandra Marashik, okay. Elio Nider, Geha Mark, Nicole Matusiak, Abu Char Mazen, Marwan Mana,
Ardra Mohan, Melon Mustafa, Sela Mobizi, Elio Nadir. Oh, okay, he's already here. Anna Nadanova, George Najar, Daniel Namazi, Philip Nazarvish, Nie Niamba, Midian Obad,
Chai Hu Kim, Barbara Oleksiak, Hong Rui Pan, Nuha Pirali, Taya Permiao, Justina Pumnaska, or Poznaska, excuse me. Hossein Rajali. Nemi Rafael. Humrat Rasi Mikoman. Rohit Sohai. Jessica Sandoval.
Elena Sinik. Mark Stasevich. Hsing Chi Sun. Genesis Urquia. Otto Valdez. Proshmaislav Varshveshki. Camilla Vitgreshnovska. Sufan Wang. Carolyn Vosik. Nicole Vorzinski.
Juying Yen. Okay. Benjamin Jadler. Alexander Shmuda. Chai Hu Kim. Young Yan Lan. And that concludes our advanced MD. All right, congratulations. So moving on to our 6MD program, we're starting off with Yab Abdallah. Next off, Saeed Abdel Hadi. Thank you. Mariam Al Musavi. Abdul Rahman Amun. Muhammad Assad. Utkrisht Ashish. And Sarah Azar.
Waihang Chan. Bochia Chui. Lotte Dalad. Shreya Day. Allaha Astan Zai. Jessica Faye. Saeed Fasal Rahman. Daniela Francis. Ikram Galmi. Sabrine Ganucci.
Raghav Gupta. Ellen Hoggensen. Muhammad Hadi. Helen Hamner. Chai Ju Shi. Zhou Hua Su. Su Xuan Huang. Wei Wen Huang. Pervana Kandola. Marta Karob Karpinska. Chen Yu Lai. Li Hisong Su. Yu Ching Lu. Anubab Maikap. Noah Maroon Abu Jaud. Jakub Osinski. Matthew O'Sullivan. Joy Popula. Shebin Salim. Amin Shaji.
Tariq Sheikh Yaman. Sithu So. Matthew Stavluski. Yuming Su, Junat Syed, Shreya Trisal, Tuyong Su, Noel Vargas, Yuqing Wang, Yuwen Wang, Wei Fan Xiao, Sen Ye, and that concludes our 6-year medical students. Now let's get started on the dental students. Okay, first off, we have Nicholas Aleshki, Jonathan Bonta, Minghao Chen, Yusan Chen, Mani Bachad Harry Hussain, Taru Kajarbo, Chen Yilin, Elena Marushko,
Olesya Marushko, Olivia Nassif, Heidi Oxeter, Sarah Usborg, Buktavar Shabir, Jai Shi Su, and Yu Feng Miguel Tan.
Thank you. Now I'd like to introduce Associate Professor Agnieszka Linska, Vice Director of Center for Medical Education English and the Associate Dean for Basic Sciences of the MD program, to the stage.
Everybody stand up. Accepting with respect and gratitude the conferred title of physician and being fully aware of the responsibilities involved with it, I do solemnly swear to fulfill my duties conscientiously, to protect human life and health, to prevent suffering and disease to the best of my knowledge, and to help bring relief to the sick irrespective of any differences as to their race, religion, nationality, political views, or financial status. Always bearing in mind the patient's welfare and showing them due respect, not to betray their confidence and keep private all knowledge concerning the patients even after their death. To protect the dignity of the medical profession, not to dishonor it. To treat my colleagues with due kindness without questioning patients' confidence towards them, yet at the same time acting impartially and having in mind the welfare of patients under my care. To widen my professional knowledge and to share with the medical world all that I shall be able to discover, invent, and improve. I do solemnly swear. Thank you.
Again, it's been a pleasure and it's been an honor to be your Masters of Ceremony this morning. So last but not least, to close out our ceremony, we're going to welcome again Professor Jan Masela, excuse me.
Okay, everybody, so you're happy, you are almost doctors. So before you go out from that room and start to treat the teeth or prescribe the drugs, please take an OSCE exam and take your pharmacy exam first, and then you are free to treat us. So with that, I'd like to conclude the ceremony and wish you all good luck.
All right, to all students, again, congratulations. So after exiting the ceremony, you have the opportunity to take professional photographs, so enjoy. Have a wonderful day.